They come to Canada seeking refuge, often with nothing. And it's been a year and a half since many refugees lost health care too. Cuts to the interim federal health program left some struggling to pay for basic services, including neonatal care and cancer treatment. The temporary health care program was once available to all refugees and similar to coverage provided under social assistance. But in a bid to weed out those who might cheat the system, it was slashed by the federal government last year. This week, Ontario became the latest province to fill the void and provide coverage, leaving some to ask, should Alberta do the same? And joining us this evening, Dr. Jessie Breton, a resident physician and one of the founders of the Alberta Refugee Care Coalition. As well, Fariborz Birjandian, Executive Director of the Calgary Catholic Immigration Society. Good evening to you both. Welcome to Alberta Primetime.
Hi, thanks for having me.
All right.
Good evening.
It has been a year and a half since the cuts were made to the interim federal health program. As a physician on the front lines, what are you experiencing? What are you seeing?
So what we've seen since June 2012, there are many categories of refugees and refugee claimants that are left without any health care coverage whatsoever. So we're talking about pregnant mothers, sick babies, survivors of torture, people who are needing care and who have no capacity to pay for it on their own. And this is a really desperate situation. We've heard stories from across the country of doctors like myself who are seeing people suffering because of these cuts. And really when it comes down to it, we're not saving money through this. We're hurting our refugees, and it's an unfair and dangerous situation for our province.
Jessie, do they get turned away at the hospital? Is that what happens?
No, actually, you know what? We don't refuse people care, but what ends up happening is after someone comes in, let's say they've been at home and they've been sick, and instead of going to a family doctor because they can't afford it, they end up getting sicker and sicker until they reach a crisis point. They come into an emergency department and are critically ill, needing expensive care, and they get a bill at the end of that. They're often unable to pay that bill, and so what happens is the hospital ends up having to absorb the costs. And when the hospital absorbs the cost, the province ultimately absorbs the cost. So this is really not a cost-saving measure.
Now, Fariborz, you've said we're a special case in Alberta, that it's tough, but there are refugees who are finding ways to make it work. How so?
I think before that, I'd like to maybe give you a little bit of picture of how many refugees are coming to Alberta and what category. There are about 400 refugees on the 3 different streams. They come to Alberta and they come to Calgary and Edmonton and other localities. Obviously, they all have a different eligibility criteria, and the cut that we received about 1.5 years ago actually denied any interim federal health support for the refugees, primarily those that are sponsored by the private groups called private sponsors, and definitely they impacted the refugee claimant quite a bit. So I think the question that we have raised was that, okay, how we can look at the providing services while that the federal government decided not to provide that interim federal health funds. I think what we learned in Alberta, if the children, I think they were in a better position. Every province, they had a different situation. In Alberta, the one that are being impacted quite a bit are people that with the chronic diseases, that are not many, but there are some, and also adult refugee claimants. And I think that is causing a lot of problem, as Dr. Jessie said, is not a way that we want to really treat people that are already in Alberta. They are coming here, the reality of our immigration process, and for us to deny them our health care if they got a flu to go, it becomes a public health issues that we should address that. The process of refugee claimant, once they come here after initial investigation and interview, they actually become eligible to work. They get a work permit, but then we deny them from some of the health services that they need to access. So that is causing a problem, primarily in a big way for the refugee claimants, but for the private sponsor, which the federal government is actually encouraging more communities to become involved in sponsoring refugees. Now the burden of that extra cost is on the shoulder of the sponsor, and that itself is also causing some issues.
Okay, and it's hard for most of us to imagine what it would be like to arrive in this country with nothing. Let's bring a third voice into this conversation.
I was pregnant, without English, without money, in a new country, new culture. I was in winter, because it was February 2001, it has been the most difficult time in my life, and I was absolutely alone.
That's Dr. Maria Martinez. She came to Alberta in 2001 after fleeing violence in Colombia. And when she arrived, Maria discovered she was pregnant. But the difference was that was 10 years ago, and she had access to health care.
Healthcare gave me the means of being healthy. Having the healthcare access gave me the tranquility that I had, that I knew that my baby was growing well, that when the time came, I had the opportunity to go to the hospital and deliver my baby in a safe manner. And then I was able to face all the challenges of being refugee and of course continue to get my life. And now I am here as a physician, and I think that without this access to the healthcare and being healthy, maybe I couldn't do it.
Nowadays, Dr. Martinez says it might not be so easy.
I cannot imagine adding this stress to the other stress factors that are related to the refugee process. So I think that I don't have words to express how the stress would affected me now if I were living that situation this year.
Jessie, what strikes you most about what we just heard from Dr. Maria Martinez?
Well, I think Maria's story is a really good example of why taking care of our refugees and investing in their health benefits all of us. There are refugees across this country that are, vibrant and dynamic members of our community that are contributing in their own ways, and supporting them and helping them adapt to the challenges of a new place will just give them that foot up so that they can be quickly adapt to life here in Alberta and become members of society like Maria, who are working to give back every day.
And she's seeing a lot of success as a physician.
Absolutely, yeah. And there are examples across the country. In fact, it is the overwhelming majority of refugees who, quickly adapt and thrive here and give back to their communities.
Fariborz, the number of refugees coming to Alberta continues to grow. You've identified that already. According to the federal government, in 2012, 5,000 refugee claimants in the province. Many are approved for permanent residency and thus will become Albertans in the future. But by making access to healthcare so difficult, how much of a risk do we put out there that they do not start out on the right foot?
I think maybe I should say that for the other refugees, except refugee claimants, there are very much a stream of services available through the Immigrant Serving Agency and community. The group that called refugee claimant, actually there is no formal services for them at all. So what is happening now in the community agency like Calgary Catholic Immigration Society and other agencies, actually we are just taking that burden without any resources to support the initial settlement needs of the refugee claimants, obviously. Now, as Dr. Jessie said, many of these people eventually become Albertan, become Calgarian, basically go through the process successfully. But I don't see the point that we try to make them really suffer more than they need to suffer, because they're already in a vulnerable situation. As you heard the former refugee claimant, the doctor describing, that it was the most stressful time in her life. And again, we are just adding to that stress. So I think what we need to do, first of all, we have to recognize that the refugee claimants to Alberta, to any part of the Canada, based on Constitution, is going to be a reality. So we have to address that. And I agree we have to address it in a more efficient, cost-efficient, and basically community-focused as much as we can. But just ignoring it is not going to be the solution. And the cut, obviously, when we have somebody is ill, they have no access to a family doctors, they end up in emergency, it's going to cost us 4 times as much. And I think that requires some big discussion led by Alberta Health. I think they should take the responsibility and leadership and actually engage the communities in a discussion to see how we're going to address this situation and what Alberta can do, what we expect federal government to do.
And we need to take a quick pause. We will come back to that point. Up next, filling the void. Ontario is the latest province to step in and start providing health care to refugees. Should Alberta do the same? Welcome back to Alberta Primetime and our discussion on lost access to health care for refugees. Probably the biggest impact of these federal cuts was the patchwork it created. It used to be that if you were here as a refugee, you received coverage. Now it's harder if you come from a country on the designated safe list, and government-sponsored refugees, privately sponsored, and refugee claimants or asylum seekers are all falling under different levels of access. Fariborz, how much success are you having in navigating all of this?
I think we are trying as hard as we can. Obviously, sometimes there are limited in how much people can access or how much the community can contribute. But definitely it's becoming more difficult for people that are trying to help this target population. As I said, as you mentioned also, is different criteria has been impacted differently. But in the beginning, we really felt that maybe Alberta Health would really step up and look at the actual need and address the issues. Again, we have not seen that, and we hope that in the future that opens the door for people accessing service in Alberta. Because the numbers are not huge in Alberta. That's the good news. I mean, when you compare the refugee claimants number in Alberta compared to other provinces in Ontario, they take probably 10 times as much as we take. So I think we should be able to do something.
Jessie, navigating the system, is it any easier for doctors?
No, absolutely not. I mean, what we did is we took a system that was fairly universal and easy to navigate, and we've made a system that is now depends on what your category of refugee is, what country you come from, and what condition you're presenting with. And so we're seeing a lot of these smaller clinics, medi-centers, doctors who don't see a lot of refugees or refugee claimants being very confused about who's covered and what is covered. And sometimes this leads to patients being unfortunately turned away or told that they don't have coverage when they might in fact actually have coverage. And so this element of confusion is just another negative effect of these cuts. And we're adding this layer of confusion to a group of people who already are facing so many barriers when it comes to accessing healthcare.
So it's the staff of the Medi-Center who have to go through the long list of
Absolutely.
You fall under this category and therefore you don't qualify for that.
And it sometimes changes depending on what condition they're presenting with. So for example, if they have got something like tuberculosis, they would have coverage, but if it's just a cough from pneumonia, then they don't. And telling whether or not someone's cough is from pneumonia or tuberculosis just up front is impossible. So it just doesn't really play out well in the real world. And really when it comes down to it, we're not asking for gold-plated healthcare for these refugees and refugee claimants. We're asking for healthcare that's equivalent to what Canadians receive on social assistance. And instead what we've left them with is a patchwork system that's left many of them falling through the gaps.
Now, as we identified in the primer, Ontario is now stepping in and providing some access to service where the federal government is not. As to where our province stands on this matter, here are some of what they state to Alberta Primetime. At this time, Alberta Health does not plan to launch a program to address the cuts to the interim federal health program. Alberta Health Services has stated publicly that all refugee classes, regardless of refugee status, are able to access emergency services. Under Alberta's health legislation, only persons who meet the definition of resident or are deemed a resident are eligible for Alberta Healthcare Insurance Plan coverage. Refugee claimants and rejected refugee claimants do not meet the definitions of residents. Jessie, your thoughts on the position of the province?
So our argument with the province has always been that cutting people off from care doesn't benefit anyone. That cuts to refugee health care are hurting all Albertans, and it's doing so in a number of ways. First, we're increasing costs. People are getting sicker, ending up with these bills being left with the hospital. We're also increasing the burden on our emergency rooms and in our hospitals because people are getting sick. Rather than going to a family doctor, they're waiting until they need to be admitted to hospital. And finally, like my colleague was saying, I mean, these are people that many of them are going to be accepted as Alberta citizens in the future. So we're really sabotaging their health during the application period. And when they do become Canadian citizens or they gain residency status, we have to play catch up on the health, the negative health consequences they suffered while they were denied care while they were waiting.
And Fariborz, you touched on it before we went to the break, but what is it that you are looking for in terms of leadership from Alberta Health?
I think, as mentioned, it is quite becoming more complicated for the user as well as for people that are actually trying to help these people. I think the first thing we need to do is to streamline the access and streamline this eligibility in a way that everybody, all the refugees, they get the basic, as mentioned, at least to the level of people on social assistance. I think this is the minimum expectation. And I think if we do that, I think at the end we're going to reduce the cost because there's going to be clarity there. Then people, they don't have to visit 5 doctors' offices, 5 labs to get an answer. And at the end of the day, it's going to be a challenge for everybody to try to navigate the system. So streamlining the process, defining it, what they are eligible, and what is the minimum eligibility for this. These are the minimum expectation that we have.
Jessie, last question to you. Can we afford this in Alberta?
Absolutely. So the Alberta Refugee Care Coalition actually looked at some numbers coming out of the provinces that have already stepped up to provide their refugees care. And just to be clear, those provinces right now are Quebec, Manitoba, and now Ontario. And based on those numbers, with our population of refugees, we're in the range of $2.3 million of an investment per year to provide healthcare to refugee claimants in Alberta. Now, and this is just a cost, upfront cost, but what we're saying is that we'll actually probably end up saving a lot more money because of the increased burden on our emergency rooms, the sicker patients that we're getting when we're not providing care. So really, when it comes down to it, refugee health is a small investment and a really big gain for our province and the right thing to do in Alberta.
Very much appreciate your thoughts this evening, both of you. That's Dr. Jessie Breton, a resident physician, one of the founders of the Alberta Refugee Care Coalition, and Fariborz Birjandian, the executive director of the Calgary Catholic Immigration Society.